Hello, and welcome to the Operationalizing PCPlus webinar. My name is Loretta Dutil, and I'm the Operations Manager for the Delivery System Reform Unit here at MainCare Services. And we are very excited to provide you with this information as part of this recorded webinar. As you may know, PCPlus officially started on July 1st, and the implementation was successful. The information in this webinar will cover these topics to assist practices in operationalizing Primary Care Plus. Report access and content. So this is reviewing the types of reports that will be available to Primary Care Plus practices and where to locate them. Methodology and operation schedule. This includes attribution, reimbursement, and quality. We will also be discussing the operations and methodology guide that will be available on our website, as well as other supports that will be available to practices. Part of our goal within MainCare is to transform healthcare and move away from the volume-based fee-for-service payments and towards payments based on quality. We've focused on these 4 components in our orientation webinars that support this work. There are currently 2 orientation webinars that are available on our website. These are the general orientation webinar and the operations webinar, which we'll be covering as part of this webinar. So the general orientation webinar covers the first 2 bullets and provides an overview about how PCPlus changes the way care is delivered and also changes how care is reimbursed to support better outcomes. The operational webinar focuses on healthcare administration, including operational processes of both payers and providers. Both webinars focus on engaging the partner stakeholder on an ongoing basis. This is an important component when transforming healthcare. And we will be providing ongoing technical supports and training that will allow for continued stakeholder engagement. This slide is a good reminder of where we are today. As of July 1st, primary care case management, primary care incentive payment, and primary care health homes has ended and has transformed into what we have today known as Primary Care Plus, which is one population-based payment that will be paid out monthly. What does this mean specifically? These next few slides will highlight the differences in the previous operational processes as compared to PCPlus. So some of the differences include member eligibility. So for primary care case management, this program was mandatory for certain MainCare members, though it did not include Medicare members or waiver members as an example. Health homes focused primarily on members with chronic conditions, and this program was voluntary for all members. With PCPlus, the members must have full MainCare eligibility. If the member has full MainCare eligibility but is also a dual member or waiver member, they're still considered eligible for PCPlus. And members can opt out at any time. For attribution and primary care case management, members selected their PCP or were auto-assigned to a provider. In health homes, members were auto-assigned based on their primary care case management assignments, and providers also manage their panels by adding and removing members. So in PCPlus, members are attributed to practices based on their primary care claims experience. So they can only be attributed if they receive primary care services at that practice. As I mentioned earlier, members can opt out of services. Since this is a truly population-based model, providers will not be able to add and remove members individually. Next, we'll be covering referrals and attestation. Under primary care case management, referrals were required in the billing system for specialty services managed by primary care providers. And under PCPlus, referrals are not required in the billing system for claims to pay the way it was for primary care case management. Though I do want to point out that there are referrals requirements that may be required under other sections of policy that will still need to be followed for those sections of policy in terms of having referrals on file for your records. And then for attestation, under health homes, there was a monthly attestation required. They had to go into providers had to go into the portal and select the members that were served each month. Under PCPlus, this is not required. We are only requiring through the application process that providers meet certain service and tier level requirements. which will be determined during the application process, which I'll be describing a little bit later in this webinar about the application process. But overall, Primary Care Plus is less administrative in terms of processes, and we hope that this will allow practices more time to focus on patient care and outcomes. Next, I will be covering reimbursement. This is the payment structure for PCPlus. It includes a fee-for-service payment, so providers will still continue to get their regular fee-for-service payments. For those providers that are getting an all-inclusive rate, they will continue to get that. It will also include a population-based payment that is based on the practice's characteristics or tiers, population and risk adjusted, and adjusted for performance and measures. The population-based adjustment takes into account the population composition, such as children, adults, age-blind, disabled, and duals, and whether or not the population falls within the generally well or complex categories. Based on all of these components, a rate is determined. Combined will be the total primary care payment. Each practice will have a different PMPM assigned to them based on their unique composition. This next slide provides more of a visual on what goes into the population-based payments. These payments include practice characteristics, which is the tier levels that I just described, and is population and risk adjusted. The red circle around the blue circle indicates that it is also performance adjusted as well. This next section will cover the application for PCPlus and answer the question about how practices are placed in tiers. The application and recertification for PCPlus will occur at least annually. These will be two separate applications. For the application process, those practices who are initially applying or are reapplying after disenrolling will need to respond to all of the requirement questions so we can appropriately assess the practice's qualifications. Once review is complete, practices will receive a notification of the results of the review and tier notification. We can also open the application up earlier than the normal annual timeline. When this occurs, this will allow for new practices to apply for PCPlus and will also allow for current PCPlus practices who meet that higher tier level requirement to demonstrate that they meet the higher requirement. For recertification, this process will occur for those practices that are already enrolled in PCPlus and are certifying that they still meet the requirements. This will be an abbreviated process compared to the initial application process. This process will allow for practices to move up and down tiers based on their current practice characteristics. However, I will mention that if practices are finding that for whatever reason, between the application and certification process, if there is some change within the practice that does not allow them to meet the requirement of that tier for more than 30 days, they will need to notify us of that change. We will, at that time, determine if there needs to be a tier adjustment or an action plan. Next, I will be handing it over to Cheryl Malik, and she will talk a little bit about attribution.
Hi, my name is Cheryl Malik. I am the program coordinator for Primary Care Plus. So, congratulations, we've made it through the first round of attribution. So those of you in Primary Care Plus should have members attributed to your service locations, if not all of them, most of them. The reason being, we do a 24-month look back. And the first time period that we used for July 1st attribution were the dates of service January 1st, 2020 through December 31st, 2021. Then we did a 3-month run-out period for claims. But some of the practices that have enrolled with Primary Care Plus actually started, created their service locations thereabouts the end of the time period that we were capturing the dates of service data. Therefore, you will see some practices that may not have attribution as of yet, but each quarter, that look back period will roll forward 3 months to capture the new, more recent pockets of members and their primary care claims. So, as I just stated, we're using claims data to do attribution, whereas, as Loretta had stated, previous programs had various other ways of actually assigning members or attributing members to practices or organizations. So we are using multiple codes, which we will be placing in the methodology, operations methodology manual or guide for you to be able to review, but we'll put the primary care codes in there for you to look at. And then the way we're using that data is we look at plurality of primary care claims. So if a member looks like in a 2-year period, they have claims for 2 different service locations, maybe in 2 different organizations, the higher number of claims, say it's 4 versus 2, the service location with the 4 claims would be where the member would be attributed, though there may be a time when there's a tie, right? So let's say instead of 4 and 2, it was 3 and 3. The more recent claims will be where will determine where the member is attributed. Members will be attributed on the first day of each calendar quarter. As we said, the first quarter was July 1st through the end of September. The following quarter would be October 1st through the end of December. So that's how attribution will be taking place as we move forward. Now, members do have the option to opt out of Primary Care Plus by contacting member services. They also have the option to update their PCP. So if they have changed locations recently, we will document that change of primary care provider, and we will make an adjustment in the following quarter so that the next quarter attribution process will have them assigned to their newly assigned practice. Again, if the member also opts out of Primary Care Plus, that would not occur until the following first day of the following quarter for attribution. As far as notifying the members, right? So members receive an attribution letter notifying them of Primary Care Plus and their inclusion in that. The first start, right, July 1st, we had over 200,000 members who were receiving letters, attribution letters. As we move forward with Primary Care Plus, only members who are new to Primary Care Plus or have changed primary care providers will be receiving those letters. So we don't solely want to send out letters to members every 3 months because it's going to cause confusion and concern. In doing so, when we actually sent out the letters to the members, we also sent a copy out to each of the primary care practices. So when you did your application, we sent you a copy of this because we would like all practices to please share that with your practice, all of the staff, or whoever you feel is appropriate to share that with. Because we do know that a lot of times when letters go out to members, they may contact your practice versus us. As well as if you ever get any phone calls asking about this program, we want to make sure that your staff is educated on that. Now we're going to talk about the next area of next areas of payment. As Loretta had done a breakdown of what is contained in the Primary Care Plus payment, we start with population groups, which are children, adults, age blind, disabled, and duals. So all members are placed into one of these 4 population groups. Then we take a look at the risk scores, and there was determinations made, kind of a cutoff for each of the population groups to decide where generally well changes over to complex care. And so in doing that, each member in your practice, in primary care practice, was placed into one of these 8 boxes. What we do initially is we take those 8 boxes, determine how many members are in each of them, add it all up, divide by the number of members, and that's where we land with the practice-wide per member per month. We will be using that per member per month as the base of all of your payments for that year. There are, of course, potential adjustments to that, as we'll go into now, but we will start with that base per member per month for your annual, your 12 months of payments. If you're interested in understanding more about our risk score model, or that model that we're using in Primary Care Plus, you may certainly go to this website. There's limited information, unfortunately, available because it's protected information. Also, it's using a hierarchical chronic condition rescaled prospective risk score. Performance-based adjustments. So as we move forward, we will be utilizing quality measures. As you can see here, there's a total of 9. These all fall into 2 domains. The first is utilization, which is acute hospital utilization. The other is comprehensive care. And so that's the breakdown of the weight of the measures. One of the 9 comprehensive care measures is controlling high blood pressure. That actually is not claims-based, whereas the others are. That one will take some time for us to determine how we're going to collect that data. But within the year, by the end of this year, we plan on sending out data for you to start seeing where your practice sits in each of these measures, and then we will be doing benchmarking and things of that nature as we move forward. And when we're getting ready to do those pieces, we will be outreaching all practices and setting up webinars and doing some trainings as necessary and providing information to your practices. So the performance-based adjustment was built to ensure that it's not just your achievement and how you perform in comparison to your peers. We also put in an improvement bonus, so how you are performing relative to your previous performance. So we want to ensure that we're capturing this in different areas so that you have the best opportunity to create a plus bonus, right? A plus payment for your practice. The performance-based adjustment can range from negative 10% of your tier payment all the way up to 25%. So again, you, based on your performance, have the ability to certainly increase your per member per month payment, because this will be added on top of the previous PMPM for your population group risk adjustment, as well as your tier amount. This can be an addition to that to increase your payment. For the first year of Primary Care Plus, as I said, we're not going to be providing quality data to you until later this year, right? But for the first year, which started with your first payment in July, we are doing a percentage for each of the practices based on their tier. So we have added a performance-based adjustment. It's just not based on quality performance. But again, we will be providing more detailed overview in early 2023 prior to implementation of the quality measures affecting the performance base or being the performance-based adjustment on your per member per month. Report access and content. So this is kind of a high view visual to show everyone kind of those elements that repeat throughout the year. So we started with July because that was the start of the program or of Primary Care Plus. So week 1 of each quarter, again, is attribution. Then approximately week 3, you're going to see the payment processing as well as reports uploaded into HealthPass for you to be able to view. And then, so that's actually going to be the reports are each month. And then towards in May, you're going to see, in the spring, you're going to see the annual application or recertification that Loretta was talking about. So we kind of want you to have a visual of those pieces that will be repeating themselves each year. It's likely we'll be adding some elements for you, looking for feedback from you to determine what might be helpful to add to the calendar for you. So as far as each payment, again, the total payment is referred to the population-based payment. As we stated before, it's based on quarterly attribution. The attribution data is generally pulled approximately the 15th of the month. It depends where on the calendar the 15th falls each month, of course, because processes through HealthPass or through MIMS don't run every day. And so the data pull will occur, then it will go into the upcoming payment cycle to pay that the week following the start of that payment cycle. The payments will be displayed on each provider's remittance advice. Again, this is at the pay to level, pay to MPI level. The payment will appear in the non-claims area of the remittance advice as PC 2.0 payment. The amount that is displayed will be the total of all Primary Care Plus enrolled service locations. So if you have 5 service locations enrolled in your organization, then that payment will include all 5 of those practices in one lump dollar amount. And if you are an organization that doesn't necessarily submit claims every week, if it were to happen that the Primary Care Plus or PCPlus payment were to process on a week that you don't have other claims, then that would cause issues because, or at least you would not receive a remittance advice. Reconciliation of this payment, right, because again, it's being rolled up to the pay to level, can be completed by comparing the data in the member roster and payment summary report, which we're going to move forward and display to you, because that will actually give you the members attributed to each service location, and it gives you the payment totals also at the service location level. What can impact your payment for Primary Care Plus? So again, these are monthly payments. Effects could be quarterly changes to your attribution. So let's say you lose a provider and you have a significant drop in your practice. Technically, that's not going to affect you until 2 years out from when the actual change happens, but it could affect it. Let's say the time period that's reviewed suddenly had a drop or an increase, right, in the number of claims found, primary care claims found for members. So again, that could increase or decrease your attribution for that quarter, thereby each month in that quarter. Changes to the eligibility status among your attributed population. So let's say you have 100 members attributed to your practice as of July 1st, and on August or the end of July, let's say the end of July, 10 members lose their eligibility. If they have not regained their eligibility by the 15th of August, then you would not be paid for those 10 members for August, because they are not active in main care at the time that the payment is processed. So that also will affect your payment. Annual changes to your practice level per member per month, or your population and risk adjusted per member per month. So again, let's say by the time we're there at our annual recertification, and you now qualify for a step up from tier 2 to tier 3, for example, that will increase your per member per month. Or let's say you have a significant change in your practice. Let's say you had a pediatric practice and an internal medicine practice, and they merge together. That is going to be a significant change to the composition of your population. So we would review, what the population groups of your members, as well as their risk level, right? And that will in fact change your per member per month as well. As I stated before, this is a report that will be very valuable to Primary Care Plus providers. This member roster and payment report is uploaded to the Health Pass file exchange area into a folder labeled as PCP roster report. This shows attributed members eligible for the monthly payment. So after, or as the payment is processing, it'll pull together all of the data that was included in that payment and put it into a report for you. So this is the summary portion, the payment summary portion. As I was saying previously, this particular fabricated organization has 4 service locations, and so it lists out their total members, their per member per month, and their total paid for the payment of that month. And as you can note there, each individual service location, because they have a different population makeup, could actually have different per member per month payments for each month. And then this is the member level detail of that report. So this, again, lists out each of the members' information, as well as the location that they're attributed to or assigned to, so that you can actually look at the member detail of what was included in that payment. Now, a field that we would like to bring to your attention is the estimated eligibility end date. And what this is, there's some disclaimer language up above. It's kind of hard to read in the screenshot, but basically what we're asking organizations to do, and again, this is something that was brought to us as well from the primary care community, was to be able to monitor where they were in their main care eligibility, right? So here we show the attribution date. We show when they were assigned to this particular service location for Primary Care Plus, but we're also tracking the end date of the main care eligibility. So these particular members, it was showing that they're due to lose their main care eligibility. Again, this is true as of the date that the data is run in this report. As of the following day, maybe the member had called in and reestablished or did what they needed to move that end date, or they could have always been end dated earlier. This, something that we don't know at any one given point. So this is just giving you a guideline to follow so that you can outreach the member, determine what are the appropriate steps. Again, part of management of the care and services, eligibility, it's all kind of part of what we want to assist you to do to manage your population. Another area for you to be able to view the members attributed to you is, and this is a screenshot both to show you where file exchange is, as we were referencing for the payment report, the roster and payment report. And here there's an area called View PCP Roster. If you were to click on that at any given time, then you would see the members who at that point in time are attributed to whichever service locations are identified in the drop down. So if you have one location, of course, then all the members would be attributed to that one location. If you have 5 locations, then you can actually select the service location and see the members attributed to each of the locations. So this helps you understand where you can find that data. Thank you, Loretta.
Thank you, Cheryl. So great. I will be providing you an overview of this next section here called Operations and Methodology Guide, and then also talking a little bit about the other supports that we will have for you. So we will be providing you an operations and methodology guide to help support you in PCPlus. The guide will give you, will provide details on the information listed here. Also included is the information that we've been discussing as part of this webinar. This guide is really meant to be a living document, so we will plan on updating it as we get additional questions from you all about ongoing operations and as we progress in PCPlus. Our goal is to provide you with hands-on information to help you be successful in PCPlus. The guide will be located on our primary care webpage, and we will notify providers when it is available, but we anticipate that it will be available sometime in August or September. Other supports that we have include the member webpage. This is a great resource for main care members that provides general information about Primary Care Plus and information about when to use the emergency room versus urgent care, and also provides a brief overview of PCPlus and includes a primary care practice listing. This is a great resource for main care members, and it also helps them to understand the different programs that they may get notified about. And then of course we have our Primary Care Plus webpage. This is where you can go to get additional information and resources about Primary Care Plus, such as application resources. This is where the operational guide will be located as well. Our goal is to provide additional resources as we identify them, and then also we will be adding our one-pager here as well. So I definitely encourage you to visit this webpage, as our goal is to make this as helpful for you as possible. So here's an overview of the different types of technical assistance that will be provided. We will be providing ongoing support to practices, including regularly scheduled trainings and specific supports for practices individually. This includes regularly scheduled orientations as well as needed trainings requested by practices to discuss PCPlus policy requirements, troubleshooting specific issues or questions, or just other supports needed by practices. We will also have peer learning opportunities available to collaborate with other Primary Care Plus practices to support each other, and then also just share lessons learned around service delivery expectations. We've also collaborated with external partners, DHHS offices and agencies, and other resources that can provide learning opportunities for practices as well. And then finally, we will be offering regularly scheduled open office hours that will be an informal meeting to allow practices time and opportunity to ask questions that you might have. We will be planning to be available for the full hour for questions, so practices can feel free to join anytime during that time to ask a question. And then finally, we do expect to have a calendar available on our website in the fall that will provide you with an overview of learning opportunities, including dates, times, and how to manage and how to join in on these opportunities. So our primary way of communicating with Primary Care Plus practices will be through our e-message system. This will be the best way to get PCPlus updates and notifications. To sign up is very easy. You will need to go to the link on this page and enter your email address. Once entered, it will bring you to the screen to select your subscriptions. There are a number of different subscriptions that you can sign up for. However, we will be sharing all of our PCPlus updates through the primary care, main care, primary care, and care coordination subscription. So you'll need to select that one as one of your subscriptions, and you're more than welcome to select any other subscriptions that you might be interested in as well. Once you've selected your subscription, clicked on submit, you will get a message indicating that you've subscribed, and you will also immediately receive an email noting the subscriptions that you've signed up for. Going forward, you will begin receiving notifications that are posted in those subscriptions. Finally, if you have any questions about PCPlus, feel free to email us at this email address. This goes to our general email and is reviewed and responded to regularly, so you can connect with anyone on our team. Just wanted to take a moment to thank you for taking the time to review this webinar, and we hope that this has been helpful for you in understanding more about PCPlus. Please do not hesitate to contact us with any questions, and thank you, and have a great rest of your day.